everybody. Welcome to Mormon Sex Info Podcast. This is Natasha Helfer-Parker, and I am beyond thrilled to have kind of one of my personal heroes on the show today. His name is Dr. Barry McCarthy. Been to several of his presentations, have followed his work for a long time, own a lot of his books, refer to a lot of his books to all of you clients of mine, and really happy to have him. Before I introduce him further, I'd just like to give a little update on how Mormon Sex Info is doing. So as many of you know, we're moving platforms. We're going from a strict subscription type of platform to more of a donation-friendly platform and going on iTunes. So a lot of the podcasts are starting to pop up for free content, especially the archived ones, so that you can enjoy more of the content. So please feel free to either access current stuff through a subscription or give a donation, and you'll have access to all of the podcasts eventually. So hoping that that's not a huge difficulty in shifting some of the ways that you support the podcast. As usual, I'm open to feedback, topics you want me to discuss, etc. So please comment on the threads or reach out to me on Facebook Messenger or however else you would get in touch with me. And anything else, Natasha Helfer-Parker, that you want to know about, you can find out on natashaparker.org. So upcoming presentations, things I might be doing, webinars, etc., you can find there. Yeah, so without further ado, let me just introduce Dr. Barry McCarthy, who is a clinical psychologist. He has a subspecialty in marriage and sex therapy. I believe this is current. If not, you can correct me, Barry, but practicing at Washington Psychological Center in Washington, D.C. He's been a professor of psychology, I think, in several places. I'm going to let him introduce himself further. He is, along with his wife, author of several well-respected books, some of the most recent being Enhancing Couple Sexuality, Sexual Awareness, Rekindling Desire. He also, many years ago now, did some really good books with a colleague around erectile dysfunction and premature ejaculation. I have referred to those books for years. So welcome to the show.
Glad to be here. Very much. Very pleased to be here.
Yeah, thank you so much for coming on. And please tell us a little bit more about yourself. So whatever I botched giving your bio, tell us more about what you're currently doing and what you're about.
A couple of things that are interesting. I am now 75 years old. I still fly up to teach at American University one day a week. I teach an undergraduate human sexual behavior class. But after 42 years, I've stopped practicing. So I basically am here in North Carolina, and I write books and give professional workshops. And that's what I do. And plus grandparenting, which is a really important and crucial aspect of my life.
Absolutely. That's awesome. Well, we are here to talk today specifically about guidelines for sex and sexuality in our golden years. So kind of after 60. And this is a topic I get a lot of questions about. I am headed there myself fairly soon, in about another decade. So I'm premenopausal and all those things. This is an area that is very interesting to me as well. And I think with the baby boomers and so many people kind of heading in that direction, and I think also with a lot of different attitudes around sexuality today, it's just a really interesting area to have good information on. So why don't you start off by just talking about just the basic myth that sexuality somehow isn't as important or decreases as we get older, when in reality we know that we're sexual creatures kind of from birth to death. So can you talk a little bit about some of that?
Let's start off with the good news. I always like to start with the good news.
I love good news.
The good news is that there's very good, solid scientific evidence that you can be sexual until at least 85. Now, I believe you can be sexual into your 90s, but at least until 85. The second part of the good news is that all the good things about sexuality come to fruition with aging. That the thing that I like the best about talking about sex and aging is that it's the most human part of sexuality. That one of the things that people who continue to be sexual will say is that they're more satisfied with their sexual lives in their 60s, 70s, and 80s than they were in their 30s and 40s. And the reason for that is they need each other more for sex to work in their lives. So the old system, the old double standard that males were the sexual experts, they got easy erections, they had easy orgasms, women were second class, is absolutely blown up. That they need each other as both intimate and erotic allies. And that one of the most interesting things about sexuality and aging is that so many women will say, throughout our lives, I've always thought of sex as his domain, not my domain. I was always trying to catch up. And now in my 60s, 70s, and 80s, I feel really good that he needs me sexually in a way that he didn't 20 years ago. And that I find arousal and orgasm often easier for me than for him. And that one of the challenges for males is to learn to piggyback his arousal on her arousal.
So yeah, go ahead. Sorry.
The new mantra sexually is desire, pleasure, eroticism, and satisfaction. And desire is the core issue, looking forward to sharing sexuality. And the key issue with sharing sexuality is about giving and receiving pleasure-oriented touch. And that's what allows people to enjoy sex with aging, rather than seeing sex as an individual pass-fail test of whether you have erections and orgasms.
Well, and what's kind of beautiful about what you're saying is that really those things are what would make sex better all along throughout life. And I think what you're saying is that the aging process in a lot of ways forces us to slow down and to, if we're going to enjoy it, we're going to have to be pleasure centered instead of performance oriented or worried about things like body image or a lot of the myths that we deal with around our sexuality anyway. Is that kind of what you're getting at?
One of the major myths is that the key to sexual desire is visual stimuli and eroticism. And that's not true. That if you look at couples who really enjoy being sexual after 60, the key issue is touch, not visual stimuli. And the key issue is that they really turn toward each other, whether the sex is wonderful or it's dissatisfying. They don't blame, they don't apologize. They say, we're going to enjoy this as a team, that ultimately sex is a team sport. And I think it's even more true after age 60.
Yeah, for sure. And for those of you who are watching, please feel free to ask questions or make comments along the way. So we'd love to hear from you, just in case you're watching. One of the things that goes along with this, I think, again, from a stereotypical mindset, is the idea that men always want sex. A lot of times during the reproductive years, especially, sometimes it's maybe a more typical presentation that maybe the female is rejecting sexuality or is exhausted during childbirth, et cetera. And so the idea is kind of that women are the ones that shut down sexuality. And this was one of the things that popped out at me in one of your presentations I attended, is that you were like, nope, actually, a lot of times it's the men. It's the men that eventually shut down kind of the sexual lifestyle of a couple. Can you talk a little bit about why that's the case?
Well, let's say it positively first again. The great advantage of sex as an aging is that you need each other both intimately and erotically. So many women look at the man as their intimate ally, but not their sexual ally. That sex is his domain and that all touching has to go to intercourse. Couples get stuck in this intercourse or nothing power struggle. What happens with aging is that they say, look, sex is certainly involves intercourse, but it's much more than intercourse. It involves sensual, playful, and erotic scenarios in addition to intercourse. And that if it doesn't flow to intercourse, and if you look at the average couple in their 60s, 85% of their sexual encounters will flow to intercourse. But when it doesn't flow, rather than panicking or apologizing, which is incredibly anti-erotic, they turn toward each other and say, let's make this a sensual night, or let's make it an erotic non-intercourse night, or let's just take a rain check and try again in a couple of days. But it's this idea of, I'm not performing for you, I'm sharing with you. And in fact, when couples stop being sexual after 60, then this is the bad news, frankly. The bad news is 1 out of 3 couples stop being sexual between 60 and 65. And between 70 and 75 becomes 2 out of 3. And in 90% or more, it's the man's decision. It's his decision because he's lost his confidence with erections and intercourse. And part of that is the fault of the drug companies. They overpromise to the man that I will get you erect. You take a Viagra Cialis pill and you'll have erections like you did in your 20s. That's a lie. It's a blunt lie. That pro-erection medications can be valuable, but you've got to have realistic expectations and you've got to integrate it into your couple sexual style. And Viagra has probably caused more non-sexual marriages since 1998 than anything else in history. Not because it's not a drug, but because nobody says to the man or to the couple what to expect and how to integrate it.
What do you want to talk a little bit about if somebody is going to try a medicine like that? What would we want to say to a couple so that they could have realistic expectations and enjoy that tool per se in ways that would really benefit them?
Well, one of the things that I would really encourage them to do, whether they're going to use testosterone enhancement, whether they're going to use penile injection, whether they're going to use Viagra or Cialis, and that is that they need to talk outside the bedroom beforehand about this concept of the good enough sex model. This was the model that was developed by my colleague Michael Metz before he died in 2012.
Yeah, I love your good enough sex model. Let's talk about that for a minute.
It says that sex is basically a couple experience, and that the ideal couple experience is mutual and synchronous. In other words, both people feel desire, pleasure, eroticism, and satisfaction. But it also says that asynchronous sex, where the sex is better for one partner than the other, is normal and healthy. And it also says that if it doesn't flow from comfort to pleasure to arousal to erotic flow to intercourse, don't panic, don't apologize. Turn towards your partner and say, let's have a good time here. Let's have a sensual experience, or let's have an erotic, non-intercourse experience, whether it's mutual or asynchronous. And that's what allows people to feel good. The notion that all sex is going to flow is absolutely crazy making. It's all about performance, and it's all about stopping being sexual.
And that it's always going to end in orgasm, or that it's always going to end in penetrative sex, which are the two big kind of ways we talk about sex, right?
We talk about sex as intercourse and orgasm as a pass-fail individual performance. That's what means you're going to stop being sexual in your 50s and 60s if you approach it that way. If you approach it as a couple experience of sharing pleasure, which includes I'm a great fan of intercourse and orgasm. I want to make that 100% clear.
Right.
Whether you're 60, 70, or 80. But that's not the essence. The essence is sharing pleasure with each other. You know, I have a great story. It's a true story. And that is a couple who began as a sexual couple, I think when the woman was 15, the man was 18. They'd been a sexual couple for over 55 years. And one of the things the woman said to the man is, I enjoy having sex with you now in your 70s so much more than I did in our teen years and 20s. And at first that hurt his feelings. He said, how have I failed you? But she said, it isn't that you failed me. It is that you need me in a way that you didn't in your teens. In your teens, you had show-up erections. And now in your 60s and 70s, you have grown-up erections. And the other thing is, she said, I really like the fact that arousal and orgasm is easier for me, and you can piggyback your arousal and my arousal. It makes me feel more needed. It makes me feel that we're more of a genuine couple. I thought that was very moving. I really thought it was very moving.
That is. That's a beautiful, and a lot of what you're saying is really beautiful. And if we could really talk more about what to expect, I'm a big believer that some of the worst things that can happen are kind of like self-fulfilling prophecies, right? And when our culture has the self-fulfilling prophecy that sex is going to get worse, or you shouldn't care about it, or that, it's no biggie if you stop having sex, those are kind of a lot of the messages that are out there around age and sexuality. And that's really disappointing and sad and unnecessary.
What I say to my men is just the opposite. And that is, do you want to be a traditional man and stop being sexual in your 50s or 60s? Or do you want to be a wise man? And wise men can be sexual in their 60s, 70s, and 80s. The big thing that wise men do is they replace this individual performance-oriented intercourse with the good enough sex model. And good enough sex never sells with male peers. It never sells with male doctors or male ministers. What it sells with is with couples. Because the woman says, I can understand and I can embrace good enough sex. That's my life experience. The number of women who orgasm the way men do is less than 10%. She's used to the notion that orgasmic response is variable and flexible. So the average woman who feels really good about her sexuality, in couple sex, she's orgasmic 70% of the time, not 100%. So she's used to this idea of variable, flexible sex. And that's what allows people to really turn toward each other and join with each other and really have a good sexual relationship. The other thing that is crucial, really crucial, is among happily married sexually functional couples. In 5 to 15% of their encounters, it's dissatisfying or dysfunctional. It's normal to have lousy sex. So the question becomes, when you have a lousy sexual experience, rather than panicking or apologizing, you say to your partner, that was lousy sex. That's okay. I still love you. I still care about you. Let's try again in a couple of days when we're more awake, alert, and open and receptive.
I love that. I love that. And that's that realistic expectations again. And when you have that as your prophecy, then you can meet it and then you can feel successful. And so, yeah, I think I heard you say, I forget the typical numbers, but it was like 60% is like good enough sex, and then like maybe 15% is amazing sex. And then like the rest of it is kind of lousy sex. So I forget your exact numbers, but
You want to hear? I mean, I'll be glad to tell you.
yes, I would love to hear. Yes.
So the best sex, I want to be clear about this. The best sex is mutual and synchronous, where both people feel desire, pleasure, eroticism, and satisfaction, including intercourse and orgasm. That is the best sex. But even if you look at these happily married, sexually functional folks, mutual synchronous sex happens less than half the time. Most of the time, the sex is good, but it's asynchronous, better for one partner than the other. But the thing that's so interesting with aging is it's the opposite of what happens in your 20s and 30s. And that is that sex is often better for the woman than the man. And part of that is that it validates the idea of sensual, playful, and erotic touch, manual and oral stimulation, that sex is much more than intercourse. And that intercourse, penetrative sex is not a pass-fail test. It's a hard sell, especially for doctors and male peers, but it's true.
Mm-hmm.
It really is true.
Yeah. And everybody benefits from that. And it is interesting that, again, stereotypically you see that shift in aging. And if a woman has been okay with that for, the first 20 or 30 years of a relationship, you would hope that a man can step into being okay with that, in the next 20 to 30 years.
Well, one of the things that I say to my male clients is that investing in this broad-based, flexible, good enough sex model is better for your well-being than putting $100,000 into retirement savings. Really makes a difference in your life. It really makes a difference in your relationship. It really makes a difference in your psychological well-being.
I love that. It is. It's such a benefit for our health. Being sexually active, being sexually engaged with ourselves, with our partners, really good for our health. Can you talk a little bit about, obviously there are some shifts and changes that are happening to our bodies, to the male, to the female. Can you talk a little bit? I mean, I know you're not a physician, but can you talk a little bit about maybe some of the things that people can expect to be different as our bodies change and shift and go through the changes of aging?
Sure. So we talk about this idea of a psychobiosocial model of understanding sexuality, not a biomedical model. And the big thing psychologically is desire and positive anticipation, in the sense that you deserve sex to work in your life. There's also extremely good biomedical news. And that one of the best parts of biomedical news is anything that's good for your physical body is good for your sexual body. And especially that's true of good sleeping patterns and good health behaviors. Mm-hmm. But one of the differences, the reason that there's not a lot of 40-year-old or much less 60-year-old professional athletes, is that your body is less of a performance machine, that your vascular system is still functional, but it's less efficient than it was in your 20s and 30s. So that part of what you have to get used to is this idea that you need to be open to pleasure-oriented touch, and that arousal is going to be slower and arousal is going to be more variable. The major reason why men fail at Viagra?
I'd love to know.
Is that as soon as he gets an erection, and if you think about arousal on a 10-point scale, 0 is neutral, 10 is orgasm, 5 is beginning arousal. As soon as he gets an erection, he rushes to intercourse because he's afraid he's going to lose it.
Yeah.
And one of the most valuable concepts is don't transition to intercourse until your subjective arousal is at least a 7 and ideal an 8 on that 10-point scale. So that you transition intercourse when you're into an erotic flow. The other suggestion that works with many, many couples is let the woman guide intermission rather than the man guide intermission. It allows him to stay involved with giving and receiving stimulation before and during intercourse, and reduces his self-consciousness about the firmness of his erection. So it's an interesting example for males. The other thing that's really important with men is you can't have intercourse the way you did in your 20s, where you just do thrusting. That one of the most valuable concepts for both men and women is the idea of multiple stimulation during intercourse, both giving and receiving stimulation during intercourse. And the most common form of receiving stimulation for men is receiving testicle stimulation, as well as buttock stimulation, as well as kissing stimulation. For women, the most common receiving, far and away, is receiving clitoral stimulation, as well as buttock or anal stimulation, as well as breast stimulation. So it's the idea of giving and receiving it, and that. The other thing I think that's important with women is that you are going to lubricate differently than you did when you were in your 20s. So that you need to be comfortable and mindful with both intermission and kind of intercourse thrusting. That the old way of having intercourse and doing intercourse thrusting, man on top, short, rapid thrusting, usually is not that positive for people in their 60s, 70s, and 80s. That woman on top, side positions, sitting, kneeling positions, circular thrusting, longer, slower thrusting seems to work much, much better for couples.
I love all of that. And especially this idea of intermission, right? Because I think a lot of times you have this idea that it's just supposed to be this upward slope to orgasm, right? And I also love the fact that you brought up kind of like a measurement scale, like knowing where you're at in the arousal pattern, right? So if 10 is like you're lose control and have an orgasm, that you can go from a 3 to a 6 to a 4 to a 7 to a 2, it doesn't have to be 1, 2, 3, 4. And I think that's what you're getting at when you.
In fact, it isn't 1, 2, 3, 4.
Right.
The other thing that's really interesting, that is a very hard thing for people to accept, but once they accept it, they feel so much better, is the idea that subjective arousal, feeling turned on, is more important than objective arousal, lubrication and erection. That's so different than what they hear. It's so different than you see in porn videos. It's so different than the way the culture talks about it. But that's one of the best ways of really enjoying being sexual with aging. That says your feeling turned on is much more important than objective measures of arousal. Now, let me say one other thing that I think gets underestimated by everybody throughout their lives sexually, and that's the importance of afterplay. Afterplay is probably the most ignored part of sexuality, but it really does reinforce a sense of satisfaction, of turning toward each other as intimate and erotic friends, whether the sex was wonderful or it was mediocre. This idea that said, I'm glad we got together. Let's do it again.
Yeah, that's such an important part. I agree, is the avoid the rollover response, right? Is that's still an area of connection. And depending on how the afterglow is different physiologically as well for certain people. Some people can stay in a state of arousal for a while. Some people maybe lose that a little quicker. But using that time to connect, to still have skin contact, to eye gaze, to say loving things, to stroke each other. I mean, that's just really, really an important part of sex. Because again, we don't want to define sex as just that intercourse part.
It reinforces this notion that the most important thing is desire, and the second most important thing is satisfaction. That you feel that worthwhile, even if it wasn't great function, if it feels like it's still satisfying experience. And that turning towards your partner, I think, is really important. Not apologizing, not blaming, which are incredibly anti-erotic.
And oftentimes what couples will do, right? Not necessarily because they're mean or stupid, but because they're frustrated or sad. I talk a lot with my couples about meaning ruts, and a lot of times we get into either self-blame or couple blame, right? Partner blame. It's either your fault or it's my fault. And maybe it's just a shift in life and we have to figure it out differently. It doesn't have to be anybody's fault.
Right. But the absolute worst time to talk sex?
During sex.
During sex is also it's after a negative sexual experience.
After a negative sexual activity. Yes.
Something about being nude, lying down after a negative sexual experience, especially if you've been drinking, that brings out the worst in people. People say and do things, they apologize the next morning, but it really hangs in there. The best time to talk sex is either in a clinician's office or the day before being sexual, will you say to your partner, next time we're sexual, this is what I'd like to try. This would be something that'd really be fun for us. Will you make a request, not a demand? And the partner has a chance to say, that makes sense, I'd love to do it, or I like this part of it, but I don't like that part. But the partner also has a right to veto, to say, no, I don't want to do this. That one of the things that I feel most strongly about healthy sexuality is that unless you have the right to say no to sex, you don't have the freedom to say yes to sex.
Oh, yes, that's a wonderful way to say that. Consent is so important, and ongoing consent and all of those things. Laura Cray, who's joining us, she says, this is so interesting, especially about sexually enhancing drugs. Of course, no one hears that they don't always work. So she really appreciated your thoughts about that. And then just going back a little bit with the physiological changes, I mean, I'm getting this off of your outline. There's obviously some difficulties in obtaining erection. You talked about, being as efficacious, in our bodies. And for women, estrogen replacement. Do you want to talk at all about that? Are you comfortable talking about estrogen replacement or testosterone?
You know who's the best physician to consult? It is not a gynecologist or a urologist. The best physician is either your internist or an endocrinologist with a subspecialty in hormonal functioning. The endocrinologists who I like and respect really, really worry about the overuse of testosterone for both men and women. When there is no testosterone, and testosterone enhancement under medical supervision is really very, very helpful. But going to the internet or going to a health store and getting oral testosterone, for most people, most of the time, is one of the worst things they can do to their body. So make sure that you're in good medical hands when you're talking about testosterone or estrogen replacement. And most estrogen is now given not systemically, but is given locally, and it seems to be much more effective for most women. But the thing I think that becomes important that I really, really suggest that you do, now your physician is not going to like this suggestion, but is to have a one-shot consultation as a couple with the internist or with the endocrinologist and say to them, we're not asking for sex therapy. We're asking how to be a better patient, whether we're talking about dealing with prostate cancer, dealing with breast cancer, dealing with diabetes, dealing with multiple sclerosis. The good news is there's no illness and no disability that destroys sexual desire. The thing with illness and disability is that it's going to alter sexual functioning, but it's not going to control it or destroy it. That's an important concept.
I love that. Can you repeat it? Just because I think repetition is a wonderful way to learn.
Well, actually, let me give you an example.
Yes.
Emily and I were in a year study about 3 years ago for women with breast cancer. Luckily, Emily had the best kind of breast cancer, level 1, that was dealt with radiation and successfully dealt with in surgery. But I got to go to her medical appointments. And at the end, what the oncologist told us, she said, having the two of you in the room together has made me a better oncologist. We can talk in specific ways about the difference between the infected and non-infected breast. We can talk in specific ways about the side effects of radiation and fatigue. We can talk about a new body image that you now have about your body and your breast. And we emphasize this notion about touching being much more important than visual stimuli. I really do think those are helpful. And it also brings out the best in the physician. Physicians are not used to talking about sex. They're not well trained sexually, but they want to be helpful. If you come in as a couple, it's much more likely you'll get some good advice and good answers.
I love that reminder. It's so important because you're absolutely right. Every aspect of our health and our bodies in some way or another affects our sexuality and our sense of self, our body image, all those things. And so as we're getting medicine or treatments or thinking about different protocols, it can be a really good thing to advocate for your sexuality all along the way. And it's hard to do that sometimes when, one, physicians aren't typically, like you said, used to talking about it. And two, a lot of patients aren't typically used to talking about it. So then there's this big chasm in the room. And so I think this is part of us as a public learning how to advocate for ourselves in this way.
And it's also, as a public, understanding what is normal. One of the most, again, I'm very enthusiastic about sex and aging, not just because I'm 75. I was enthusiastic about sex and aging when I started teaching as a 27-year-old.
Yeah, yeah.
But, the typical battle between women and men is the battle about intimacy versus eroticism. And it's the idea that eroticism is the man's domain, intimacy is the woman's domain. One of the best challenges of sex and aging is that you understand that you need to be both intimate and erotic friends. So the challenge for the woman is to find her erotic voice that really does fit for her. And most of the advice on the internet and all of the advice in porn videos is actually destructive for most real life couples. That it says eroticism is about no boundaries and it's taking big risks and it's all crazy making. That is not true at all. Eroticism is integral to women, to men, and to couples. And in the same way, older men need to learn to value intimacy and non-demand pleasure. That in fact makes him a more fully functioning adult man. And it makes it so much easier for them to speak the same language to each other. They don't split by traditional gender roles. Is that too theoretical, or does that make?
No, that totally makes sense. And I really, I always struggle a little bit with all the differences between men and women and whether or not they're really there, their environmentals, but it doesn't really matter. A lot of these themes are there and how we conceptualize ourselves, and at least in a lot of heterosexual relationships, with being a woman or being a man and what that means. And especially even in religious cultures like my own, I think that's even amped up even more, as far as what a woman is supposed to be, what a man is supposed to be, and how they're supposed to show up sexually. So that resonates with me as far as what couples come in with complaining about.
We have two thoughts on that.
Yes.
The one is that the science is pretty clear that when it comes to adult men and women, not adolescent young adult, but adult men and women, there are so many more similarities and differences psychologically, relationally, and sexually. I think the other is that there are different challenges. And I like the idea of vulnerabilities and challenges. The typical vulnerability for men is this idea that I'm supposed to always be strong and have no questions and be sure of myself sexually. That's a terrible way to lead your life. One of my favorite statistics is that 85% of men believe that their penis is smaller than average.
Yeah.
Either statistically or logically, but it's true that the message to men is you're not good enough sexually. And often the message to women is you shouldn't value sexuality, especially eroticism. So think about it as different vulnerabilities with different challenges. Now, let me say something, although I don't know very much about Latter-day Saints. I know something, and basically the science says that moderately religious people do the best sexually, and conservatively religious people do the second best sexually. Sex is much more of a challenge for less religious people. I think that's very interesting. And I think the thing that is healthy about Mormonism or LDS is that it is such a pro-marriage, pro-family religion. And that is a great basis to start from. But then I think you've got to challenge some of the self-defeating rigid stereotypes about men and women.
Yes, I would agree with all of that. I think, do you have any thoughts as to why the religiously oriented maybe do better sexually than those who don't have as many religious values? Like what are some potential blind spots that we might be thinking about as researchers in that field, in that area? What's that about? What do we know?
Critical thought, and that is whether the person is LDS or the person is Baptist or the person is Roman Catholic or whatever, Orthodox Jewish, is to encourage them to have a one-shot free consultation with a minister or rabbi or imam of their religion. And all religions now are pro-sex and marriage. They argue about everything else, about abortion, about sexual orientation, but everybody's pro-sex and marriage. And there's something about a minister or a rabbi or a LDS bishop giving you permission to be sexual that is really powerful. I remember there was this, I never met the Catholic minister, but he sounded like he was a wonderful guy, and my clients absolutely loved him. Where the Catholic minister would say to them, God wants you to be sexual. That being sexual is like saying a prayer, it's a spiritual good deed to do.
Mhm.
And they said, the nuns didn't teach me that in elementary school. And a Catholic minister would say, look, you're now an adult married Catholic. Catholics are the second most sexually functional religion in the United States. Get with the program. God wants you to enjoy intercourse and orgasms. That's really good permission giving,
Mhm.
at least in my view.
Yeah, and so to have somebody who represents kind of this theology that you're a part of to give permission to be
Right.
sex positive in some ways can be very helpful for people who I think oftentimes, I mean, having grown up in the religion myself, we tend to get a lot of sex negative messages when we're teens, like when we're not supposed to be sexual. And so then when that carries over sometimes, right? And then so then I think what you're saying is having that permission can be very helpful.
But part of that permission is the traditional permission of being an adult married person. Now, for people whose sexuality is different than the mainstream sexuality, that is more of a challenge. But still, I think there are ministers who will support your challenge.
Right. Yeah.
That the way to think about healthy sexuality is it's this 15 to 20% role in your life. That's the way to think about it.
Hmm. Hmm.
Um, rather than something that destroys or subverts your life.
Right. Like it's an important piece. It's not the only piece. It's in its place with lots of other puzzle pieces of your life that make
Hmm.
your existence satisfying, content, pleasurable.
All right, this idea of this 15 to 20% role, that the role of sexuality, whether you're 30 or you're 70, is to energize your bond and allow you to feel desire and desirability. That's the core of healthy sexuality.
One of the things that you talked about here is that the average frequency of sexual activity after 60 is once a week, and that you one of your pieces of advice is to maintain a regular rhythm of sexual contact. So can you talk a little bit about why that's important and what type of, I guess, sexual contact you would recommend?
I would recommend this broad-based sexual contact, sensual, playful, erotic, and intercourse. This idea that it's intercourse or nothing, I think is so destructive. So when a couple say, when you have a whole bunch of alternatives, where you can say to your partner, let's have a great mutual intercourse experience. That's one option. Another option is let's make this a mutual sensual experience. Another option is let's do erotic, non-intercourse sex, either taking turns or mutually. Another option is let me hold you while you stimulate yourself to orgasm, or let me pleasure you to orgasm. The more alternatives, the better off you are.
Hmm.
And in my view, when I think about healthy sexuality after 60, it's being sexual at least every other week in some way, because it keeps alive that connection. If you're sexual like only once a month and it's intercourse or nothing, it just puts way too much pressure on you.
Hmm.
It isn't
Hmm.
really part of your life. Like Emily and I go swimming 2 to 5 times a week. It's part of our life.
Hmm.
Being sexual, whether it's twice a week or being sexual 3 times a month, it's part of your life. When it becomes less than once a month, it isn't part of your life, and it becomes much too much of a self-conscious performance, and that's not good for you.
Right. I love that. And I think this also gets to the point where you have to, I think sometimes people have this idea that sex is just supposed to happen or that horniness is supposed to be organic and you just wait around for this to kind of come along, this feeling, right? Whereas I think when you say, well, we go swimming 3 times a week, you don't ask yourself, oh, body, are you just naturally wanting to go swimming? You go swimming.
Well,
You've prioritized it, right?
one of the biggest differences at 60, 65 as opposed to 30, 35 is that the time that most people have learned to have sex is late at night. If you look at people who really feel good about their sex lives after 60, they seldom have sex late at night.
Mm,
You want to be sexual. I mean, one of the advantages for most people is you have more flexibility with aging. So you can be sexual before or after a nap. You can be sexual, you take a run and then have a shower. You can be sexual in the early evening. Sex is an appetizer before dinner. That you want to be more aware, awake, and not being worried about being interrupted by kids or phone calls.
mhm,
Take
mhm.
advantage of the good things about aging.
Yeah, I love that. So it's intentionality and it's planning, and you're being very specific that if you're going longer than 2 weeks without some sexual type of energy between you, it's going to get harder. It's going to get more anxiety focused. It's going to be more pressured between you.
There's nothing more anti-sexual than self-consciousness.
Yeah.
Let me say one other thing that I probably haven't emphasized enough. I've talked too much about men instead of about men and women. The most valuable concept in understanding female sexuality, whether at 30 or at 65, is this idea that it's first class, it's not inferior to male sexuality. And a major concept is called responsive female sexual desire. That what most men, now again, sexually, one size never fits all, but most men learn to function sexually autonomously. In other words, he feels desire, he gets an erection, he goes to intercourse on his first erection, and orgasms on his first erection. That's the typical male learning. Very, very few women function autonomously. For them, their experience of sex is intimate, interactive, variable, and flexible. And the female model is the one that really works with aging, so that it's perfectly normal for both men and women to begin an encounter at 0. And as you touched and are being touched, as you're aware of your own emotions and your partner's emotions, and you start feeling subjective arousal, that's when you feel desire. So responsive sexual desire is applicable to both men and women, and it's the most common way they feel desire. It isn't they feel desire and then they touch. It is that they touch and then they feel desire.
That is such an important point, because that goes against kind of this myth that you're just supposed to be horny all the time, or that it happens naturally. Desire is a function. I mean, that can happen. You can get horny, but a lot of it is desire. A lot of desire is a function of relationality, and that as you engage, as you are willing, as you touch, as you pleasure, then desire kind of kicks in, and it can
Right.
be really something wonderful. So it does take a certain level of willingness to see if that's going to happen.
Right. And that, let me make a point that is really crucial. And that is what is healthy about asynchronous sex and what is unhealthy. What is healthy is that it's perfectly normal that the sexual experience is better for one partner than the other. What is unhealthy is when the asynchronous sex is at the expense of your partner or the expense of the relationship. And that goes back to this idea that you need to be able to veto things that don't work for you, or used to work 20 years ago but don't work now. And it frees you up to experience new things sexually. And that sense of the woman, especially the woman, being able to veto and trusting that her partner will honor her veto, really sets a good relational formation for pleasure-oriented sexuality.
Well, and one thing that you talk a lot about is each person being responsible for their own desire, and that goes against some of, I think, the gender stereotypes of how we're brought up, with women kind of waiting around to see if they're going to be pleasured. So I think an invitation also for many women is to initiate, like you're saying, to veto, to know themselves, to be an active participant. Do you want to speak about that particular aspect?
Yeah, the thing that's fascinating is that the field of female sexuality has been totally revolutionized in the last 20 years. But somehow all those good learnings have not gotten into the culture. And one of those biggest learnings is this idea that you're responsible for your own desire and your own orgasm. It does not come from your partner. It's the total opposite of an R-rated movie. It's really the opposite in porn videos. The message in porn videos is the crazier the woman, the more erotic she is. That's not a healthy message for most women, or the great, great majority of women. The message that says you have a right to your sexual voice, including your erotic voice, is really an important message. And then the second important message is the idea that you turn towards your partner as both your intimate ally and your erotic ally. In my clinical practice in Washington, I no longer, after 42 years, I retired from practice. But in my clinical practice, I must have heard over 2,000 times, I love my spouse, but I'm no longer in love with him. And what that's all about is she has de-eroticized him. She sees him as sexually, it's his domain, it's his rules. They're playing sex by his rules. And so she's de-eroticized him and de-eroticized herself.
Mhm.
And that one of the challenges of learning to be sexual in your 60s, 70s, and 80s is to integrate intimacy and eroticism, both for yourself and for you as a couple.
Yeah, I totally just say amen. I agree. I agree wholeheartedly. And I think that although, you've spoken several times about how pornography offers really kind of very unrealistic expectations, I know that there are external stimuli that can be part of pleasure and fun as long as you're using it correctly, like it's entertainment. It's not like a teaching tool.
Well,
It's
there
not
are
a place,
couples
right?
who will watch videos together as foreplay.
Right.
There are couples who will experiment. It's called role enactment arousal. Will experiment with things like being sexual in front of a mirror so you have visual feedback,
Mhm.
or who will buy a sexual toy and play with a sexual toy. But most of the time, eroticism is about partner interaction arousal. And the other big change that happens with aging is self-entrancement arousal becomes much, much more common. Self-entrancement arousal means that you take turns giving and receiving, but the receiving partner is not passive. And that's the whole problem with traditional foreplay. In traditional foreplay, the woman is passive. It's the man's job to arouse her. In pleasuring and interactive sexuality, you both give and receive touching. And with self-entrancement arousal, you are active in that you're mindful, you're guiding your partner, but you're receiving. You're really letting yourself go and receive.
Mhm. But you can be interactive, I'm guessing, in what you're saying, and like sighing, moaning, moving their head if they're doing genital stimulation. If like you're still, even though you're focused on pleasuring, you're communicating,
You're
and that's how
communicating.
you're participating.
But again, in terms of nitty gritty specifics, and again, if this is too much, stop me.
It's not too much with me.
You know, only 50% of adult women feel comfortable receiving oral stimulation. There are more adult men willing to give oral stimulation than women to receive it. And the reason for that is that for most men and most women, but especially women, unless your subjective arousal is at least a 5, doing oral sex is going to be anti-erotic. It's going to get you self-conscious because it's supposed to arouse you, but you're not aroused, and you're in your head and what's wrong with me and what's wrong with my body. One of the most valuable concepts is don't do direct genital stimulation until your subjective arousal is at least a 5 and ideally a 6 or a 7.
I'm so glad you brought that up. I think that's, again, so important to know because, again, I think men are hearing a lot of the new information. Oh, okay, clitoral stimulation. That's what I need to do, right? And like you're saying, a lot of men are super willing. They want their wife or partner to be having a good time. So they immediately go to those areas. Whereas you're right, you need a certain level of like anticipatory arousal and different erogenous zones before you kind of hit, the target per se.
Well, let's be specific about clitoral stimulation. And that is, if your subjective arousal is a 2 or a 3, he can be doing the best technique he's ever read about in one of these sex magazines, and it's not going to have a positive effect on you. It's going to have the effect on you of being a spectator, of observing your response and saying, why aren't I responding?
Mhm.
As opposed to feeling that he's your intimate erotic friend, and that when you're feeling turned on, that's when you take his hand and guide him to do clitoral stimulation. Or you take his head and say, this is I want you to come down on me. That's the way to think about this.
Right.
Not that the technique itself is the key issue. It is the notion of sharing it when you're into a pleasurable erotic flow.
Yes. And one way too, just to second your opinion, is just I talk a lot about nipple stimulation this way. Like if somebody came and grabbed my nipple right now, it would hurt and I would probably punch you out, right?
Right.
But if I'm like
That's
at
a
a
good veto,
level,
right? That's a
right,
good veto
yeah, I would
punching
be
you out.
like, woof, like there's no way you're touching my nipple right now. But if I'm at a level 3 or 4, all of a sudden that is really that's my first erogenous zone I want you to go to before I want you to even go to my genitals, right? So that's me. I mean, that can be people can be different on that. But
Right.
the boundary between pain and pleasure is really predicated on arousal. What feels good when you're aroused is very different than the same touch when you're not aroused. And so
That's
you're
exactly right.
talking about that very well.
That's exactly right.
Super important.
I think the other thing, if we can go back to males a bit, the notion is that 100% of males enjoy being filleted to orgasm. That's what's the belief in the media. There's no scientific support for that at all. There is not good science. Sex doesn't have as good a science as it should. But probably as many as 1 out of 4, 1 out of 5 males do not feel comfortable receiving oral stimulation. They would never say that to their male friends. They would never say that to their female partner. But it's true. And so this idea of vetoing isn't just by a gender, by the woman. The man has to have a right to veto too, and that she can accept his veto, and that they can work. The basic concept is this 1-2 combination of personal responsibility and being an intimate sexual team. Because ultimately, sex is a team sport. You win or lose as a team.
I love that. Yes.
And I think that's especially true with aging.
Yes, right. And to not get stuck in these meaning ruts like, oh my gosh, you don't like oral sex. There must be something wrong with me. I must not do it well enough, or you must not like me. Or no, it's just like we all come with our own tastes and preferences, right? And we all kind of come with things that are kind of, I don't know if you want to say wired, but we come in a certain package, and certain things work for some of us and some of us don't.
Let me put one other controversial topic before we have to start wrapping up. And that has to do with erotic fantasies. I know that's very, very controversial. But let's talk about it healthily first. And that is that erotic fantasy serves as a bridge to desire and a bridge to erotic flow and orgasm. That probably the major kind of multiple stimulation in partner sex is use of erotic fantasies. And that erotic fantasies by their nature are not socially desirable or acceptable. Nobody fantasizes about having sex with their partner in their bedroom in the missionary position. Nobody does.
That's a good way to put that.
Fantasize about things that are not socially acceptable.
Or that are risky, or that you wouldn't normally do.
Right. And understand that fantasy is a totally different dimension than reality. And that one of the best ways of destroying erotic fantasies is by sharing them and acting them out for most people. They wind up being a dud. Fantasy is a totally different phenomenon than reality, and that it's perfectly normal to use erotic fantasies on your own and with your partner, and don't share them in any detail. For most people, it's a real turnoff. Now remember, sexually, one size never fits all. There's always going to be exceptions, but in general, there's so much. When I ask my college students, how do you keep eroticism alive in an ongoing relationship? They always have their hands up. They say, by sharing fantasies and watching porn. Again, there's no science at all behind that. And I think, in fact, for most people, it's a turn off, not a turn on.
Yeah. No, that's a really good point. And I talk, because this is a controversial issue. And why is it controversial? Well, I believe that we have a real ownership issue in the way we talk about marriage, and especially in religious cultures. It's kind of like this, well, we belong to each other now, we're one, we should share everything, we should have everything be together. And if you have anything in your mind that you're not sharing with me, it can almost be felt like a betrayal, or like it's not, it's something that's going to drive us apart. And it gets really scary to think about my partner having an erotic lifestyle or privacy of their own. And I think that's a real area where we can all kind of get a little bit more emotionally mature on. Is that fair to say?
Well, no, I have a specific notion, and that's what I say to clients, is you are not clones of each other. That this idea that you are a satisfied, well-bonded, when I think about healthy relationships, satisfying is the most important. Secure is the second most important. And sexual is the third most important. And the role of sex is that 15 to 20% role. But you don't give up yourself to be sexual. You maintain your sense of sexual autonomy, your own sexual voice. And your sexual voice will always be different than your partner's sexual voice. That's the norm. This idea that you become clones of each other and you should never think of anything other than your partner, I think is absolutely destructive, and it's actually anti-intimate.
I
intimacy.
and it's sad because when you lose that autonomy, then like you're saying, desire takes a tank, takes a tank job, and then you're both struggling and feeling really disconnected. So you kind of almost have to go against the grain to get what you really want, which is what I think committed, loving, religious couples in my community want, is intimacy, is sexual connection.
But what I would tell them is they want this combination, make it broader about intimacy, non-demand pleasuring, and finding erotic scenarios and techniques that really work for you.
I love that.
That's the name of the game. And
I'm sorry?
I would say, one of the best messages in terms of the religious community is take advantage of the emphasis on a healthy relationship and a secure relationship, but also allow it to be a genuinely free sexual relationship.
Love it. All right. I know we're at the end of our time. This has been wonderful. Do you have anything that you'd like to share that you feel I didn't ask you about, or that you're thinking, I would love to just make this one last point?
But if there's one last point to make, it's this idea about the genuineness of sex in your 60s, 70s, and 80s. That it really is a more human experience. You need each other in a way you didn't 20 years ago. And that it's one of the best investments you can make in the quality of your life and aging is to keep this broad-based sexual relationship going.
And if I hear you right, and many people that I've known, we've got the best sex yet to look forward to. So that's a very positive thing.
That's right. I agree.
Thank you, Dr. McCarthy. I really, really appreciate your time. I know it's super valuable, and this has been a treat for me for sure. So take care of yourself, and glad to hear that your wife is doing well with her treatment and the prognosis that she had. So for all of those of you who are listening, I hope you enjoyed this. I think you have just listened to some tremendous wisdom. I encourage you to listen to it again. I think there was a lot of things here that would be helpful to kind of make sure we really integrate into our thoughts and our ideas about how we're going to navigate a huge aspect of our lives. I mean, we're talking about like 4 decades here that most of us will be able to live through. So everybody have a great week, and we'll see you next time at Mormon Sex Info. Take care.
We took the long road home, turned minutes into miles. And as the evening traveled on, the sunset bathed your smile. We stopped beneath the desert stars, wrapped in each other's arms. Was as simple as I love you, an ordinary, extraordinary truth.
It's been a long road here, a trail with tears, pain and sorrow too. But through every storm we traveled on, like lovers do. And if sometimes we fell apart, we always came back home. Was as simple as I love you, an ordinary, extraordinary truth. People say love is blind and forever is too long. But I see your eyes in every sunrise. Can't imagine life alone. Let's take the long road on together until we're gone. Want you by my side till the day I die and into the beyond. It's as simple as our love is. That's how I wanna go, all wrapped up in the arms of our extraordinary. It's nothing ordinary love. Ordinary. No, it's extraordinary.